This is skill 4B in EMT, long bone immobilization. Be sure to check out my longer video on just splints in general that have a little bit of best practice on how you might use these. This one's really quick for the EMT as a basic skill that you would do. And so remember, as an EMT, we're only applying a splint on scene if our patient is not a critical patient. Otherwise, I'm going to find that in my head to toe assessment, and then I might just mark that on my chart notes and move on. I don't want to delay scene time of a critical patient for a long bone splint like this. So think about that as far as your critical decision making, because the way that you would see this skill is worked into your scenario. It's not like some of our other skills like sports medicine where you're going to get, tape this ankle and do this range of motion exercise. It's going to be all kind of built into that decision making. So as you take your trauma or your medical patient or both, you don't know what that scenario is going to be, right? You might have one patient who's a trauma patient and both you and your partner are working on that patient together. It might be you and your partner on a medical patient. It might be two different patients and you're both doing something, and it could be both traumas, both, medicals, kind of whatever's going on with that. So you need to kind of both know how to do your assessments for medical patients and trauma patients, and then know the appropriate care, whether that's they're an apneic patient and you need to bag them, whether they're in a CPR type scenario that you need to apply the AED and do CPR. This one would be maybe within your trauma scenario, maybe within their medical scenario, they broke a bone and they're not critical, and so you decided to splint that with a long bone immobilization. So again, I go into more detail of how the different types of splints that you might choose to bring. But the biggest thing is that throughout this skill, you're doing your PPE or BSI, your body substance isolation, or your personal protective equipment. That's going to be set at the very beginning of your scenario, and they're just going to maintain that you continue to do that. So remember, this rubric is being worked in with another rubric. One judge might be just scoring your assessment abilities, and another judge or judges might be looking at the actual then skills that you apply in the treatment of your patient, because the other rubrics have to do with the actual treatment skills. So as you do this, you're going to have your body substance isolation always on. That's an easy point there at the top. And then depending on how you're working with your partner, if you're working solo with your patient or your patient's awake, we want to have manual stabilization of that. So if it's an arm, I might want my patient to hold it up against their chest. If it's a leg, I might have my partner come down if they're available, depending on that, and hold manualized stabilization. So I might grab down here at their foot if it's broken here and just kind of pull and hold that in this manual stabilized place. You might ask the judge if you have a ghost partner. They'll tell you yes or no depending on that scenario. So you might have somebody that can hold that. You'll definitely have a ghost partner that would be able to hold spinal immobilization at the C-spine if you had chosen to do that. So depending on how the scenario works up, they might tell you that they want somebody holding that there, or that you could verbalize that somebody's holding manual stabilization of that spot. So whether it's the arm or the leg, both long bones, we're going to go ahead and do that way. And then we're always going to test pulse, motor, and sensory, like I said in that video, before and after splinting. So remember to do both at the same time. That way you can compare left and right. So if I'm in the feet, find those pedal pulses. Motor, can they wiggle their toes? I don't know that I want them flexing their foot a ton, depending on that break, but wiggle their toes, and can they feel sensation there on the tops of their hands, or feet, excuse me. If it was an arm injury, same type of thing. I'm going to check pulses. Can they squeeze my hand, and can they feel as I pinch on the top of their hands there? So pulse, motor, sensory. And then you're going to apply the proper splinting material. Again, off the top of my head as I'm making these, I can't remember which events require you to bring your own splints and which ones would have those provided. So for example, you might bring a SAM splint. You might bring more of these wooden style splints with you if you are bringing your own for this event. And make sure you kind of know how to use both if it is one that you aren't required to bring and you're relying on Montana HOSAs. Only rely on Montana HOSAs if we tell you that we would be providing that. Make sure you have your gotta have it supply list. And I always recommend sometimes bringing your own equipment. That way you know how it works and you're not flustered by the equipment challenges. So from there, you're going to get your proper thing. You're going to have it immobilized, and just like I showed you before, we're going to go use a cravat or a triangle bandage rolled up, and using that splint, I'm going to go above and below the brake. So if I was using this splint, again, the same splint, you can find more information on how to use it in that other demo video. But I'm going to get this formed here to Randy's arm, and I'm going to go above and below his brake. If we have moulage, you'll be able to see where that brake is at. So let's say it's right here. I'm going to put another bandage over on this side. So ask them if you can't see it, if it's not done with makeup there. And you're securing that entire injury. So I might choose to go ahead and immobilize that into a sling. And that kind of thing. And then I'm going to finish again with pulse motor sensory. So pretty simple skill within the EMT. Just make sure you know when you use it and how to use the equipment that you're providing.